The COVID-19 pandemic has pushed some uncomfortable but important conversations to the forefront. Get this, 1/3 of U.S. adults have had a conversation with close family members about their end-of-life plans. That's according to a new study from financial services firm Edward Jones in partnership with AgeWave and Harris Poland. Joining us now to discuss this is Allison Carney with the Edward Jones Trust Company. Good morning to you.
Hello, good morning.
Well, we appreciate your time this morning because we really want to break this down. But first, how has the COVID-19 pandemic really impacted people's attitudes about their health and finances?
It has really caused Americans to be a lot more open and willing to talk about things that maybe were too uncomfortable to talk about before. I know the pandemic has been really tough for many, many Americans. But I would say that this is maybe one of the silver linings that's coming from it. People having conversations that haven't been had before. So 44.5 million Americans had first-time conversations during the pandemic about topics like finances, health, and legal plans. And I would say another silver lining is that 71% of Americans say that the pandemic has brought their family closer together, which I think just facilitates these conversations even further.
And when you're having those conversations, then what are the most essential end-of-life documents to have in place?
So there are 3 essential end-of-life documents that make sense for many Americans to have in place. It's going to vary from person to person or state to state, but those documents are a last will and testament, or sometimes just referred to as a will. And this gives you the opportunity to dictate where you want your assets to pass when you pass away. It also gives you the chance to name somebody to administer or do all of that for you. And then it also gives parents of minor children an opportunity to name a legal guardian, somebody to take care of those kids if something should happen to both parents. The second document is a medical directive, sometimes called a healthcare declaration. It goes by a few different names, and it spells out your wishes during an end-of-life circumstance. So if you're in some sort of vegetative state, what sort of life-prolonging procedures do you want or perhaps do you want to avoid? And then the third document is a durable power of attorney. So this is a document that gives you the opportunity to name somebody to act on your behalf in the event that you're unable to communicate or make financial or medical decisions for yourself. So these are the 3 most important documents, things to talk with your estate planning attorney about. But here's the catch. Only 19% of adults age 50 or older have all 3 of these documents in place.
And a perfect time to do that with the holiday gatherings coming back. You're able to have those conversations there. And really quickly, where can we go for more information in case this is really resonating with our viewers?
For a lot more information about the study and these topics, you can search edwardjones.com/new retirement.
Well, we appreciate your time this morning and bringing this to our attention. So hopefully if this is a conversation that perhaps is in somebody at home's future, have a great place to start now to have those conversations with those family members. So thank you so much.
Thank you.
If you're thinking about the legacy that you want to leave for your family, that website right there on your screen that Allison mentioned, just head there for more information.